So I'm Dr. Bains. I'd like to talk to you a little bit about Botox and fillers, what the difference is between the two, and the applications for it, when to use each. For those of you who are not familiar with the terms, fillers literally means what the word states, really. It fills in places in your face which has hollowed out with age, with loss of fat on the face, which is quite a common reason people age a lot when they start to lose fat on their faces, different parts of the faces. When it comes to Botox, really what it does is that it relaxes your muscles, and that's how it works. So it's much better on lines that move a lot as you speak. So for someone who has a lot of expression on their faces, raising their eyebrows a lot, frowning a lot, squinting their eyes a lot, you will find that these expression lines with age gets deeper and deeper, and that's when Botox comes in. So once again, Botox is for lines that moves when you have action on the face. Over time, you will find that these lines then stay and they don't really disappear anymore. And Botox still helps in those lines, but perhaps not as much as a little bit before. With fillers, it's mainly for volume loss on the face. When you lose your fat with age, everything sinks a little bit lower. So let me just explain this to you with a little lady that I drew earlier on. To sort of give you an idea of what works where. So if you look at her, you will find that some of the most common places that people actually have wrinkles and lines is here, your frown lines, you've got lines here, you've got crow's feet. Very common areas. You've got these little lines, the neck bands, you call them little neck bands, the platysmal line. Some people have a really strong jaw. Okay, all these are basically muscular activities, and also in this area, the chin. Some people have a really dimpled chin or a very square chin. All these things basically refer to when you have excessive muscle movement, and these are the places that is mainly for Botox. So Botox can relax these lines, it will relax these lines and those. And in terms of how much you want to do it, that's really up to you. You can go for something which is quite a natural look, where you still have some movement. The lines don't totally go away, but it's it's a natural look. Versus other people actually prefer it when everything gets wiped out. And for that, generally all it means is that we'll have to put in a bit more of the toxin to get that effect. And usually these are the kind of syringes that you would need to use for something like Botox. And it's tiny, it's very small, and you'll find that it's not really that painful. A question we frequently get asked is how long do these things last, because it can mount up the cost. What I tend to tell people in regards to Botox is that it generally lasts for only about 3 to 4 months the first few times you do it. And some people like to wait till it's completely gone before coming back, but I actually think that is a waste of money. In a way, can feel like false economy, because what you are doing with Botox is you are asking your muscle not to remember to make that action, and by doing it regularly in the first 2 years, you'll find that after that you literally will not remember to do that action, and hence the muscle, without having to do more Botox, you actually get very good results. And that's in a way literally what's happened to me, where I don't frown as much as I used to anymore, pretty much because I forget. How do you know what you're paying for when it comes to a product like Botox or Azalea, or they have a few different brand names. Generally, most places in the UK at least will charge it according to what they consider to be 1 area or 2 areas or 3 areas, and most people get a little bit confused as to what these things mean. So 1 area generally refers to this whole area, another area would be this area, a third area would be this area. So for 3 areas you'd be covering this, and this. It's one way of doing it. In the US, they tend to do it quite a bit differently. They actually go by the number of units a person needs, and they will simply charge you based on how much it's used. In a lot of ways, that's quite a bit fairer, because men tend to need quite a lot more to achieve the same results as women. Also, some people need quite little because they want a much more natural look, and others would need a lot more. So what I've done is, for my clinic, what I've done is to introduce this concept of a soft fill, where with the quantity used for 1 area, I could do more than 1 area, just because I think it's a fairer way of pricing, and frankly, I think it's a much better look. Now, Now let's talk a little bit about where we can use fillers, and once again we'll go back to our lady here. Now with age you'll find that the fat on your face sort of goes downwards with gravity. So one common place that you have the fat falling down to, the most common place in fact, is here. Okay? The nose to mouth line, you'll find that this part of your face tends to go a little flat. The fat falls down here and then you start to get a heaviness here. You also tend to get a heaviness here. So these are your nasolabial lines, these are your marionette lines, and these two are the commonest, the places that most people would really want to put in a filler. One place that a lot of people don't seem to know about, but is actually a really, really nice place to put the filler, is mid-cheek. A few other areas that fillers can be used, which people don't generally think of, and some of these are referred to as the 8-point facelift, or liquid facelift, a lot of different names for them, and that generally refers to reshaping this part of the face. So you could actually have fillers put in this area, even this area, to redefine the whole jawline, because with age you lose your bone gets resorbed and you get less bone here, and by redefining this whole area gives you a sharper profile. Another place where you tend to lose weight, especially in men or very slim women, is this, your temples. Another area where filling in these zones, you find that the results are really, really good. My preferred material for filler is a hyaluronic acid filler, which is a brand that I like, is this. And how it generally comes is in these. And this thing, I'm not sure how clear it is a whole syringe in there of 1 ml of filler, and that's literally all it is, just 1 ml, and that's actually not that much. However, it's frequently enough for these areas. And the practitioner will usually tell you how many you need based on what's required in your face. This is another filler that I tend to like to use quite a lot. Now this is not a hyaluronic acid filler. It contains polycapronolactone, and the difference between this and a normal filler is that this one has both qualities of a filler, and it also has qualities of collagen stimulation. And one reason it's such a nice product is because as the filler quality goes down, your collagen builds up. So at the end of the year, you actually would have more product in your skin with a product like this, more collagen in your skin. Fillers last anything from 3 months to 18 months, depending on the filler used, depending on which area it's used in, and what's contained within the fillers. Now, fillers are mostly hyaluronic acid, as I mentioned before, and there is such a thing as cross-linkage, which means the more it is, it's like a fabric that's woven. If it's woven very closely together, that's going to last quite a bit longer. However, a product like that won't be suitable for some parts of the face. Like, you actually need quite a soft product for these areas, this area, but you need something which has more of a scaffolding kind of a property for places like your mid-cheek, because you literally want to be able to raise it. And that's where the cost of the filler differs for different parts of the face, not only because it's technically more, it could technically be more difficult, it's also because the type of filler used is different, and there is a reason it's different. When it comes to Botox and fillers, some people can find it quite scary because all they see in newspapers are these overly done faces, which once again is not reflective of how the average person looks when they come out of these procedures. What we like to do here and what we are passionate about is actually creating a very, very natural look. Most of our clients don't even know what I've done, they just know that they look less tired. And I think that's the best compliment of all, when someone is able to look at you and ask if you've had a holiday. And that's what I think we should all try to achieve.